mass in thyroid is referred to as a thyroid nodule. It is found in about 4 to 7% of adults. Thyroid nodule is classified as a benign nodule or malignant nodule. Benign nodule is a quiet nodule that does not invade the surrounding tissue or metastasis. As such, treatment is not needed if there are no uncomfortable symptoms. However, a malignant nodule refers to a tumor, and if it is proven to be cancerous upon pathologic examination, the standard treatment is clean removal through surgery.
The treatment indication for a benign thyroid nodule is when it is 2 centimeters or larger and causes a cosmetic problem or other discomfort. For treatment, a thyroidectomy, which resects the nodule with a portion of the thyroid, has traditionally been used. However, as it is a benign nodule, the possibility of a non-operative, minimally invasive treatment method has long been studied and used. The consideration of the functional aspect. This includes the following.
A thyroid radiofrequency ablation is one of the minimally invasive treatment method that selectively treat thyroid nodule. It is the same technique used in liver and kidney tumors. And this procedure retains the thyroid parenchyma, and so we can preserve thyroid function. It is also very useful because it does not require neck incision. And its excellent efficiency has been proven through many recent studies.
Only symptomatic benign thyroid nodules are candidates for radiofrequency ablation therapy. Therefore, it is important to check whether the thyroid nodule to be treated is benign. The nodule needs to be confirmed to be benign through a biopsy, which should be conducted at least twice or more. Also, when treating patients with nodules that are 2 centimeters or larger, because of cosmetic reasons or discomfort, only those patients whose discomforts are expected to be relieved by the treatment should be treated.
These are the equipment and the tips for thyroid radiofrequency ablation. The tips for thyroid radiofrequency ablation are shorter than tips for other organs. And they are designed that way to ensure the manipulation would be easy. There are various electrodes so that the treatment range can vary in accordance with the size of the nodule. Mechanism of irreversible cell damage without the carbonization of tissue is very important in this procedure. As such, the frequently used electrodes has internal cooling system of circulation of water inside the electrode. On the contrary, for the treatment of small nodules, the electrodes have no internal cooling system, and this type of electrodes can control the temperature of the tip with some kind of temperature sensor.
Similar with performing a thyroid ultrasonography or biopsy, treatment is done with the patients lying down with their neck fully extended. To minimize damage on the surrounding tissue, the transismic approach and moving shot technique is used. To check the voice of the patients as well as complications, the treatment is performed under local anesthesia having conversation with the patient. Although it may vary in accordance with the status and size of the nodule, the treatment is generally completed in about 30 minutes.
According to the follow-up result presented in iFootSol 2013, the volume reduction rate was 41% at 1 month from a procedure, and 61% at 3 months, and 76% at 6 months. These were almost the same as the result reported in other previous studies. This is mixed cyst with multiple citation. It's very hard to get sufficient result with percutaneous ethanol injection in this type of lesion. With radiofrequency ablation treatment, over 90% of volume reduction was achieved after 1 year. Moreover, discomfort caused by the bulging contour was relieved as well.
This is a female in her 40s who is complaining of bulging neckmass. The patient underwent radiofrequency ablation therapy. 1 month later, the mass is completely ablated. After a follow-up of 1 year later, there is only small one mass of ablated tissue remains, and her discomfort was completely relieved.
This is a patient who complains of swelling caused by large cyst and solid nodule conjoined together. Both of these were treated with radiofrequency ablation. After 4 months, we could get good ablation results like these, and the symptom of patient was relieved.